Hello all. Thanks for joining us for this data webinar, Advancing the Family Planning Measurement Agenda. My name is Jason Bremner, Director of Data and Performance Management with FP 2020 and now FP 2030. It's my pleasure to have all of you joining us today and also to be joined by data partners from Track 20 project with Avenir Health, as well as members of the Performance Monitoring and Evidence Working Group, as well as colleagues of mine with FP 2030, who you'll see over in the panel on the right amongst the panelists. So it's great to have all of them and all of you with us. Thanks for the early questions. Yes, this webinar, this live webinar will be recorded and the materials will be available afterwards. So thank you, and hope to provide you all with resources that you can refer to in the future. We have a packed agenda today, and I will be showing you that agenda now. Thanks. We will talk briefly about the FP 2020 to FP 2030 transition. We won't be covering all of the transition, but we will provide you with some additional resources where you can go for more information. And then we'll really be focusing on the FP 2020 to FP 2030 measurement transition, including an update on the FP 2030 measurement framework and the process that's been undertaken, as well as the outcomes of that process. We'll close with some thoughts on next steps, and we hope to have plenty of time for questions and answers and a discussion about the measurement, the new FP 2030 measurement framework. Next slide, please. To do this, you will hear from several people today, including myself, Emily Sonneveldt, who is the director of the Track 20 project at Avenir Health, as well as Paulin, who is co-lead with the FP 2030 Performance Monitoring and Evidence Working Group, and also at the Africa Regional Office of IPPF. So thanks, Emily and Paulin, for joining. We'll be trading back and forth a bit on the presentation today, but you'll hear from all of us. So with that, I'll start to dive into the content on the FP 2020 to FP 2030 transition. This transition has been a lengthy one, started in the late days of 2019 and into 2020 with community consultations about what the family planning community wanted to see next. And those consultations and those findings have been presented at previous webinars, and there have been previous webinars on the changing architecture and governance around this future FP 2030 initiative and partnership. Part of that change is, as I mentioned, a focus on new governance structures, new regional hubs, as well as new opportunities for countries, partners, donors, private sector to make new commitments to FP 2030 and to reaching women and girls with family planning. The timeline for transition during 2021 and 2022 has also been a long one and extended with the pandemic, and I'll cover that in just a second. But first and foremost, I want to just say that the FP 2020 vision is carried forward in a new vision for FP 2030, which you'll see on the next slide. And that vision is a future where women and girls everywhere have the freedom and ability to lead healthy lives, make their own informed decisions about using contraception and having children, and participate as equals in society and its development. This vision comes as comes out of the long consultation process on what the community wanted to see next. To achieve the transition from FP 2020 to FP 2030 is going to take a long time, and the timeline that I'll show on the next slide, please, illustrates just the 2021 to March 2022 period. As I mentioned, the transition started well before this. What I want to focus on in this slide are a few of the measurement timeline highlights and where we are right now. You'll notice at the bottom left is a box there that says finalized measurement framework. Here in the second quarter of 2021, we are working to finalize definitions, data sources, or highlighting all of the data sources needed, and to disseminate this measurement framework to the community. And that is the purpose of today's webinar. In the next set of boxes there, you will see that we also will be transitioning some of the structures of FP 2030, including recruiting a new cohort of performance monitoring and evidence working group members towards a future group that will convene later in the year. So stay tuned for more information on that, and I'll come back to this at the towards the end of the webinar. Next slide, please. So with that, I first want to hand it over to my colleague, Paulin, who will describe a bit the process that's been undertaken to move from the FP 2020 to FP 2030 measurement framework. So with that, I'll turn it over to Paulin and turn to the next slide. Thanks.
Okay. Good morning, everyone, and good afternoon. Thank you, Jason. And I'm presenting now on behalf of a PME working group colleagues, myself, Paulin, and Ilene Speizer and Sarah Bradley. So here, as part of the FP 2020's effort to establish a foundation for the next phase of a partnership, the Performance Monitoring and Evidence PME working group has worked over the past year to develop a proposed measurement framework to track country progress from 2021 to 2030 and report on progress towards overall a FP 2030 vision. The working group consists of family planning measurement experts, whose role is to provide technical advice and support for monitoring the progress of a partnership, to promote the use of data for knowledge sharing and to inform decision making, and contribute to the understanding of quantitative and qualitative evidence in key dimensions of family planning. Next slide, please. Next slide. Okay, over the last 12 months, the PME working group has reviewed data and evidence, conducted analysis, debated different measurement approaches, and provided input and feedback on the framework. This FP 2030 measurement framework builds on the FP 2020 result framework and core indicators. The annual process of country analyzing the family planning data, holding stakeholder consultations on progress, and reporting on core indicator has led to increased capacity of data analysis, more regular conversation on progress, greater transparency on family planning measures, and more opportunity for the use of data for decision making. Based on these successes, the PME working group has aimed for a degree of consistency which the existing framework, while also proposing some changes and area for continued work in the next partnership measurement agenda. Next slide, please. The process of updating the measurement framework has resulted in several outcomes, including the FP 2030 Track 20 measurement learning series, which summarizes several important lessons learned in measurement over the past 8 years. A vision level result statement, which ties the overall FP20 2030 vision to measure an indicator in the FP2030 measurement framework. The FP2030 measurement framework, which lays out the indicator we aim to measure over the next decades, and the FP2030 measurement agenda, which articulate the work that remain to improve measurement and understanding of key dimension of family planning. So now, the next slide, please. Okay. I will now turn to Emily and Jason, who will take us through many of the outcomes of this process. Thank you.
Thanks. Next slide. With this, I'll turn it to my colleague and friend Emily Sonneveldt, who will talk about quite a bit about what we've learned through FP 2020 and how that ties to what we'll be doing next. So Emily, I'm going to turn it to you now.
That's great. Thank you. I have the opportunity to share some of our lessons learned. And as you can all imagine, that over the last 8 years, there's been a lot of analysis and discussions and work. And it was really an opportunity to look back and to think about some of the things that went well and didn't go well, and how we want to make sure that we leverage these to the extent possible as we move forward. So I'm just going to focus on sort of two broad areas. The measurement advances in harmonization and approaches that facilitated data use. And I'll give a couple examples underneath each of these categories. This isn't meant to be exhaustive, but instead meant to give an idea of the types of questions that we're asking ourselves and the type of analyses that we're undertaking to make sure that we really maximize the learning that we've had over the last 8 years. So if we go to the next slide. So we often talk about the advantages of looking at all women contraceptive prevalence from a rights-based perspective. And that's true, right? That marriage shouldn't be a barrier to contraceptive services for women and girls who want them. But there's also some advantages from a data perspective. So this slide is going to give us some different ways to look at the advantages of using all women as opposed to only prioritizing or only counting married women. So the best way to look at this slide is to start in the upper left-hand corner in that box, and then we'll work our way clockwise through the graphics. So in 2020, unmarried women represented only about 6% of the total family planning users in the 69 FP 2020 countries. However, over the 8 years, they were responsible for 35% of the growth in total users, right? So small population, but certainly a growing population. And if we look to the graphic on the right, hopefully everybody has seen one of these graphics. We show them quite often. This is looking at the change in total users from 2012 to 2020. The dark blue is looking at married users, and that little small, very red sliver across the top is looking at unmarried. But between 2012 and 2020, the number of unmarried users doubled. It went from about 9 to 18 million. In those 69 countries, while the total number of married users increased by about 20%, right? So that red sliver is small, but it's really growing at a much faster rate. So like all of the indicators that we look at for FP 2020, there's a lot of variety hidden in the aggregate. So in the graph in the bottom right, we're gonna look at the same concept of the contribution of unmarried users, but we'll look at it by the subregions. So at the top of that graph, we have Central Africa. This is looking at the percentage of total users who are unmarried at the beginning and the end. So what this shows is in 2020, in the Central Africa region, about 43% of total users were unmarried. In West Africa, it was about 1 in 4. And in East and Southern Africa, it was about 1 in 5 of users were unmarried. And then it sort of decreases as that graphic goes down until we end up in some of the Asian subregions where the percentage is relatively small. And then lastly, if we look in the bottom left, these are the 10 fastest growing countries in 2020 of the 69. And the yellow dot represents the percentage point change for the year. And then the red bars represent the percentage of total users who are unmarried at 3 different points in time, 2012, 2016, and 2020. So what we see is that in all countries except for Senegal and Ethiopia, the percentage of users who are unmarried is growing, and that this growth is contributing to that rapid change that we're seeing in the yellow dot. Right? So from a data perspective, looking at all women was also the right thing to do. Of course, it is from a rights-based perspective, but it is also from a data perspective. We go to the next slide. So this is just taking that same concept and breaking it down from a subregion to a country level. So you can see the percentage of total users who are unmarried in each of the 69 countries. I won't go through all of them. People will have access to the slide deck. So we can go to the next slide. So the second concept is the choice to use modeled annual estimates. So within the methodology that was created for FP 2020, we're able to have estimates of contraceptive prevalence, unmet need, and demand satisfied for all countries each year. And this isn't just the 69 countries, this is all countries, which is actually a big advantage now as FP 2020 looks outside, or FP 2030, sorry, looks outside of the 69 countries. The methodology that was set up in the beginning is already applicable to any other country who chooses to make a commitment. And importantly, in addition to using surveys in these modeled estimates, we also leverage family planning service statistics, which allows us to capture change earlier than waiting for a survey. So we're able to understand if what governments are implementing now is having the impact that they want, and that data can be used when producing annual estimates. So between 2012 and 2020, on average, there were about 18 surveys conducted in the 69 countries each year. So that means if we had relied on surveys, only about a quarter of the country would have had a new survey each year. So we would have had very little data to understand the full change in the 69 countries. And that doesn't even count the 12 to 18 month delay between data collection and when we have actual access to that information, right? So that's where service statistics really comes in handy, when we have information around near-term trends that we can use to understand progress. So this was possible through a methodological collaboration with the UN POP Division, Amherst University, and Track 20. And the tool that's used to produce these estimates is called the Family Planning Estimation Tool, or FPET, which is a free online tool. It's available, anybody can interact with it. There's a full training manual that's available online that includes exercises and descriptions of the methodology. So the methods are available not just to the commitment making countries, but to anybody who is interested in engaging with it. So using this type of methodology also allowed us to create a standardized approach across countries. So all of the countries are producing estimates in the same way. We don't have to compare different surveys. And in many cases, this methods are being used or adopted for internal government reporting. So not only do we have a standardized approach globally, but we have a standardized approach at the country level as well. So next slide. And then certainly from a Track 20 perspective, one of the most important successes that we've had over the last few years is the process with which we do the country reporting. So the way that the numbers are produced that show up in the FP 2020 annual report each year is done through an approach that uses standardized indicators, tools, methods, and a validation process, right? And it's being done through a bottom-up approach, meaning that the numbers that you see are being produced in countries, in ministries of health, by government staff. And this is possible through capacity building and support to countries, which has resulted over these past 8 years in a cadre of trained M&E officers. And these M&E officers sit in governments, and they are able to fully maximize the data that's available to determine progress of family planning programs. And this cadre of M&E officers has really developed different networks to do country exchanges, right? So they're learning from each other in an ongoing basis. They often have discussions around improving data quality and timeliness. They recently, of course, they've been having a lot of discussions around reporting and data quality during system shocks. They've been expanding and pushing the use of service statistics, and in some countries, creating and testing new indicators. So before COVID, many times these exchanges happened in person. Now they're all virtual. We hope that we go back to be able to do it in person as well, hopefully soon. But this cadre exists, and they've set up networks where they're able to learn from each other. And we've seen the benefit from that as countries talk about ways that they've improved data quality, talk about ways that they've changed the type of information that they're collecting through service statistics, and how they leverage that information within their government discussions. Next slide, please. So if we switch to that second topic, which is some examples of data use, we're going to give just 2 examples within this. Again, not meant to be exhaustive, but meant to give an idea of the type of things that we're thinking about and how we can continue to leverage them. So over the past 8 years, we've really helped to create a framework to help understand and determine how to balance investments in supply versus demand, right? So what this graphic is showing you is something that we call the demand curve. And along the x-axis is the mean ideal number of children. Along the y is contraceptive prevalence. And so basically what this graphic tells you, if on average, women want to have 7 kids, this is if you look at the 7 on the bottom, if you go up to that line, you can see that we haven't really seen a country to achieve a contraceptive prevalence greater than 15, if that's the ideal number of children, right? So that purple line is called the line of maximum. And the closer you get to that line, the less available demand you have, right? So here, countries that are represented by the green or the gray dots, they still have room to grow before they hit that line. So investments in access could have some improvement or could continue to grow MCPR. But as you get closer to that line, whether you're yellow or red, you need to start shifting that balance of investment more towards the demand side. So one way to think about how this has changed over the last 8 years is if you look in those blue boxes on the right and only look at the last bullet. So if we looked at data from surveys prior to 2012, there was only one country that would have been red on this graphic. So only one country that would have been very close to that line of maximum. But now, if we look at data from 2015 or later, what you can see is what's in the graph here is that we now have 8 countries in red that have little or no room to grow without investments in demand. So the growth in contraceptive use that we've seen over the last 8 years has brought us toward that line in some countries. In most cases, that's because there's been too little investment in demand generation. And as we move forward, we need to think about that balance and how what that's gonna look like for the next 10 years. So if we go to the next slide, sometimes I think a specific country example is an easier way to understand this. So what this is showing is the example of Senegal. So what you see here is back in the 1980s and 90s, Senegal, most women wanted 6 or 7 kids. Growth in contraceptive prevalence was relatively slow. It's about 0.5 a year, went down to about 0.3. But then somewhere around 2011, Senegal prioritized family planning, and they really increased their growth rate. So you see in green that they were growing about 2 points per year. They were able to maintain this over a few years. And then they actually were able to even bump it up. You can see that in the blue box to be a little bit more than 2.5 percentage points growth per year, which again, they could maintain for a couple years. But then with the newest surveys in 2018 and 2019, you see a stagnation. And this is really because if you look at the growth in Senegal, they're going straight up towards that line, right? You have a little bit of movement towards the left at the very bottom, but starting in about 1997 or somewhere around the late 90s, what you saw is a straight increase going straight up to that line with massive investments in access and very little investment in demand. Now, Senegal has now started to invest in demand, but it was probably a little bit late. So there's going to be a little bit of a lag time in terms of being able to achieve some growth. Again, we need them to move left along the graphic. So the next slide. So this is just another perspective now of how to look at that growth, not just as a total growth in contraceptive use, but how each method has performed. So if you look at the third box, this is representing the years where we saw that really fast 2 and 2.6 growth. And what we see is that a lot of this growth is coming primarily from injectables and implants. The growth in these two methods are really driving that increase. But as we move to the box all the way on the right, what we see is implants continue to grow, but now it's at the expense of injectables. So we're still having some method-specific growth, but it's really more related to method switching and to some slowing in other methods. And that's part of that story of that stagnation in growth within Senegal. So looking at both how all methods are growing and how individual methods are growing can give us different perspectives on how we want to look at that balance between supply and demand. Next slide, please. So the second example that I wanted to give about data use is looking at how we identify and try to program towards opportunities. So over the last 8 years, we've had a lot of discussions around opportunities for family planning programming. They're often linked to high impact practices. Probably the two that are most commonly discussed are opportunities for postpartum and opportunities for youth. So this graphic or this slide is looking at postpartum. And so although over the last 8 years, there has been actually quite a bit of success in increasing use amongst postpartum women, and that's what you see in the two graphics on the right. But what I'd like to talk about are the numbers on the left. So even with all the effort that has been put in over the last 8 years in identifying and programming towards opportunities, in 2020, in the 69 FP2020 countries, there were still 62 million postpartum women who are not using a modern method. There's 32 million married youth with an unmet need for a modern method and 10 million unmarried youth with an unmet need for a modern method. So although there's been progress, there still is quite a bit of opportunity that remains within a lot of these high impact practices. Next slide, please. But as we move forward, we want to make sure that we're improving the analysis that we do in ways that don't just better balance investment and don't just encourage contraceptive growth, but also make sure that we're finding opportunities to expand the quality of services and, importantly, the choice of services and the choice of methods that are available to women. So one of the ways that we want to improve the analysis that we're doing looking at opportunities is to try to integrate components related to choice. So one way to do that is to look at the methods that are offered in the various responses to the opportunities that are identified. So this slide is just looking at method mix, and it's looking at the 69 FP2020 countries and then grouping them into the Asia and Africa regions. Of course, these graphics would look very different if you were looking at subregions, but this is just an example at the aggregate. So on the left, what you really see for Asia is that it's a story of permanent methods, and that looking forward, prioritizing long and short acting method availability for spacing would be a way to improve choice or to increase choice. And then for Africa, it's really a story of short acting methods, and that we need to think about prioritizing the availability of long acting and permanent methods as we think about opportunities going forward. So we have seen growth in implant use in Africa over the last 8 years, and in some countries, significant growth, but it's still overwhelmingly a story of short-acting methods when we look at the aggregate. So we want to make sure that when we present opportunities, we think about the kind of activities that will be used to meet those opportunities and making sure that choice is a central component of those so that we're not just growing contraceptive prevalence, we're also improving quality and and increasing the number of methods that are available to women through the various interventions. So I think that's it for me, but just to say that all of this will be available and more, because we really are diligently trying to make sure that we're learning from what we've done and making sure that we get better as we move forward. So thank you.
Thanks, Emily, for sharing a number of those lessons. Some of these lessons that Emily has talked about have at this point been written up through a joint FP 2020 Track 20 measurement learning series. This measurement learning series, which my colleagues will provide a link to in the chat, includes various content such as written briefs, graphics, additional analysis and data, as well as some interviews and quotes from the Track 20 M&E officers from the field. The measurement learning series thus far covers the measurement of contraceptive use among all women that Emily talked about, the lessons around global indicators and country reporting. There's a piece on setting goals to measure progress, which Emily didn't talk about today, but is really important for commitment making in the next initiative. There's a piece on communicating uncertainty that I will come back to in the FP 2030 measurement framework. And we are working on two more pieces in this series, one on adolescents and youth, and another on tracking family planning, financing through family planning expenditures. So keep an eye out for these, read the ones that we've already worked on. And as Emily mentioned, the Track 20 project will also be working to document all of the lessons that they have learned through data analysis and data use. Next slide, please. So I'd like to start turning to some of the additional outcomes that have come through the PME working group and data partners process towards the FP 2030 measurement framework. One of the initial outcomes was a piece of work by the PME working group on a vision level results statement that would provide a bridge between the broad vision of FP 2030 and the things that we're measuring in a set of core indicators. And this vision level results statement squarely focuses on modern contraceptive use, ensuring that we are measuring modern contraceptive use as a critical indicator. And I'll just go ahead and read this and then talk about some of the additional components. The vision level results statement is that voluntary modern contraceptive use by everyone who wants it, achieved through individuals' informed choice and agency, responsive and sustainable systems providing a range of contraceptives, and a supportive policy environment. The feeling was that that simply focusing just on contraceptive use makes it seem as though there's just one indicator and a primacy around use. This vision level results statement makes very clear that it's necessary and essential to measure lots of other aspects of the supportive environment and the system and in the individual's choice and agency. So as we reviewed the existing measures, we looked towards these individual responsive health systems and supportive environment levels to see where there are gaps in the measurement, the existing FP 2020 measurement framework, and where more work is needed. And I'll come back to this as we review the measures. Next slide, please. So what you see here is the FP 2030 measurement framework as it stands today. I say as it stands today because my colleagues in the PME working group like to remind me that it's an ever-evolving framework. the work is never done in terms of improving indicators, reviewing indicators, hoping to add indicators where there are gaps. Each of the indicators in the FP 2020 measurement framework was reviewed, was assessed for improvement, and decision was made to include it, possibly drop it, or make modifications through additional analysis. The blue indicators right now are finalized and are recommended for the FP 2030 core indicator set. And there are a few indicators in orange here where we're either still assessing the indicator or still just making some additional tweaks and changes to ensure that it's improved and ready for our 2021 effort of reporting. I'm going to come back to this in more detail, so we won't get into too much on this right now. In the next slide, you will see, however, the effort to look at those individual system level and supportive environment level aspects of the results statement, and the I standing for individual, system with an S, and supportive environment level with an E. And there still is a reliance heavily on those individual level indicators, but we are making efforts to explore new possible indicators and sources on the systems level and on the supportive environment level. Next slide, please. So overall, the measurement framework aims for consistency. One of the things that we wanted to ensure was that as we are building the FP 2030 initiative and partnership, we aren't losing the lessons we've learned on measurement, and many of those are due to a consistent reporting process on a core set of indicators, as Emily mentioned. So largely, the indicator framework is consistent with what's been done, but there are some updates, and there's a list of updates here. I'm going to turn to each of these individually in a moment. So I wanted to provide this with this slide to you also when you go back and look for the individual components or want to report out on these. You have a list here, but I'm going to go one by one in a minute. However, in assessing the updates needed, there were a lot of areas where the group felt like improvements in measurement were needed, but we aren't yet there in terms of being able to identify specific indicators. So during the FP 2020 era, we have often talked about an FP 2020 measurement agenda, areas for future work or areas for effort in improving measurement. This time around, now that we are in 2021, the group felt it was critical to identify those areas at the beginning of the initiative and call action towards an FP 2030 measurement agenda. The next slide shows these areas for future work, and there are many. So I think this call to action is a large one. It does talk about several of the areas that people are asking about in the chat around demand, around the social behavior change efforts that might be needed to create community support or to create the individual or the supportive environment for an individual to use contraception. So indicators that measure that through social behavior change. There is certainly a need to build some regular reporting on policy financing and accountability, and we have some ideas on how that might be done in the next initiative through Avenir Health's and Track 20's work on a national composite index on family planning, and that's still being explored. There's a lot of work necessary on improving a measurement of rights and empowerment principles for family planning. And I've seen a lot of questions on that in the chat, and we can come back to that in the question and answer. Among those rights and empowerment principles is the right to quality information and services. And there continues to be an effort to improve the monitoring of quality, including not just the facility measures, but client perspectives on quality. There remains a need to improve our measures of empowerment, agency, and autonomy. We do have an indicator on that we have had since the beginning on decision-making around contraceptive use, but recognize that this is not sufficient. There's a lot of discussion about an effort to improve measures of equity, and we'll be working on some statements around that in the measurement framework. That's a larger document that's forthcoming. And then a lot of discussion about better understanding of fertility intentions and desire to use contraception, and a real close examination of our measures that we call unmet need and demand satisfied, and how they actually relate to fertility intentions and desire to use contraception, because they certainly do not equate exactly unmet need and demand satisfied, and we can come back to that in the Q&A. So there is a rich area for future work for measurement partners, and and we will be laying out those areas in this FP 2030 measurement agenda. So with that, I want to go into a few of the measurement framework updates that I think would be of interest. I'm not going to spend a lot of time on each of these because the full measurement framework will be available with sections on each of these that you can read up on in the near future. But I'll provide a couple of pieces of information to spark conversation in the Q&A. So first, the expanded geographic scope of reporting. FP 2020 has been focused on the 69 poorest countries as measured back at the time of the London Summit of Family Planning in 2012. FP 2030 in its new structure will be open for any country to make a commitment, but in terms of the measurement framework, we've determined that our initial approach will be to focus on reporting for 78 low income and lower middle income countries based on GNI per capita in 2018. The latest figures on GNI per capita through the World Bank Atlas method are available for 2019, so we are assessing any possible differences there. But we'll be focusing on low income and lower middle income, meaning an FP 2030 progress report will start with this baseline of countries. That includes all but one of the original FP 2020 69 focus countries, Indonesia, which has now moved into the upper middle income category. So we're still looking at how upper middle income or even high income countries would be treated should they make commitments to FP 2030, and how we'll incorporate those into reporting. This matters because when we start out at the beginning, people ask us for regional aggregates and for comparison. And so this is our starting point of 78 low income and lower middle income countries. Next slide, please. Emily mentioned the importance of measurement of all women modern contraceptive prevalence. And this certainly aligns with the FP 2030 vision, and we'll be continuing towards that vision of reaching all women. However, as Emily showed, it's really critical to understand underneath that all women modern contraceptive prevalence, the changes both among married women and among unmarried women. So we will be disaggregating those modeled estimates from all women to married women and unmarried women, so that all of these can be tracked and the data can be explored by countries. Next slide, please. An important change is that we will be moving from tracking additional users to tracking total users. Now, this is not a large change because to calculate additional users, we have always needed the information or derived it from information on the total contraceptive users in a country, and then compare it to a baseline year to determine our additional users. However, when you're only focusing on the additional users number, you lose the context of what that additional users number means in terms of the base of contraceptive users. So we feel that a focus on total users will allow countries to still compare how many more users they have seen over time in a past year, but it'll give them a sense of the scale of that growth. And I think that the changes in additional users in context of a total users are really critical. For example, in West Africa, I might tell you that there are double the number of contraceptive users in 2020 as compared to 2012. If I showed you that number of additional users, it wouldn't mean that much to you. But if I show it to you in comparison to the total of number of contraceptive users, that's quite a feat because it means that they have doubled the services that they are able to provide to contraceptive users. So we feel that this is an important change over time. Next slide, please. Starting around 2018, the PME working group began talking about communicating uncertainty and the importance of communicating uncertainty around estimates. This is something that the HIV/AIDS field has been doing for quite a long time in their annual reporting, which is to show uncertainty around estimates, and felt that it really was not part of the common lexicon of the family planning community. So this year, for the first time in our FP 2020 final progress report, we communicated uncertainty around our contraceptive or modern contraceptive prevalence estimates, as well as confidence intervals around some survey estimates. And our feeling is that this is an important step for the family planning field that will help countries understand and evaluate progress, understanding whether the change they're seeing is real change or fits within bounds of uncertainty. And it'll improve data transparency and lend more credibility to our methods. So we're excited about this step. It may seem a little statistical and wonky now, but I think we're doing our best to work with partners to understand this uncertainty, to start talking about it. And it really has been a regular part of Track 20 country conversations, as Emily mentioned, during that country consensus process. So we really feel like that also needs to trickle up into global conversations as well. Next slide, please. In addition to some of the changes that the group felt were important around disaggregation and communicating uncertainty, was the importance of better understanding traditional method use, where in some countries traditional contraceptive prevalence is still quite high. So by focusing only on modern contraceptive prevalence, we might be missing a part of the picture. And so the decision has been made that for countries where traditional contraceptive prevalence is 5% or higher, the annual estimates of contraceptive prevalence, which includes that traditional contraceptive prevalence, will be reported. So this helps us to understand countries where traditional contraceptive prevalence is still prominent and where women are taking steps to prevent unintended or unwanted pregnancy, but not through a modern method. It also really helps us to contextualize those indicators of unmet need and demand satisfied, as those are substantial components of an unmet need for modern methods, in that there are women who do not want to get pregnant and say they're not using a modern method, but are using a traditional method. Next slide, please. Over time, during FP 2020, we have been increasing the availability of data and resources on adolescents and youth. And in the FP 2030 measurement framework, we have formalized this by both including the adolescent birth rate, which has been the traditional indicator, not just for FP 2020, but for the Millennium Development Goals, for the Sustainable Development Goals, for every woman, every child. So we retain the adolescent birth rate, but feel that the adolescent birth rate on its own isn't sufficient to understand adolescent and youth sexual and reproductive health. And so we're supplementing the adolescent birth rate with a set of indicators on sex, marriage, and birth, around family planning, use, and sexual activity, and more information is available in the full framework, where you can see the supplemental indicators. And in addition, we will have a new data visualization resource released very soon, I think as soon as next week, that allows partners to explore these data outside of just the large Excel file that we've been providing to partners over time. Next slide, please. I know this has been a lot to cover, so I will just briefly say that there are also new and adjusted indicators. I don't think we want to get into a lot of definitions right now and a lot of talk about indicator reference sheets, but these will be available in the measurement framework. The Method Information Index, which has been one of our core indicators under FP 2020, will move to something called the Method Information Index Plus, and as it adds a question that will soon be available in the Demographic Health Survey on whether a user was told about the possibility of switching methods. So this is a new question, and over time, as those results become available, we will incorporate that into this FP 2030 indicator. We are adding an indicator on the source of method that looks at the extent that women rely on private, public, or other facilities for contraceptives. And so this is available from a Demographic Health Survey, from the PMA surveys, and from the mixed surveys. And we'll be adding this as an important piece of understanding the system, that system level of family planning delivery. And we are still exploring, I won't say that this indicator is finalized, we're exploring an indicator on unintended pregnancies that may look at the percent of births that are unintended. We have traditionally been reporting on the absolute number of unintended pregnancies in a country, as well as unintended pregnancies averted through use of modern contraception. We are considering adding a measure on the percent of births that are unintended, but stay tuned for more analysis and a look at that possible indicator. So that is a quick run through an FP 2030 measurement framework and measurement agenda. We aren't done in 2021. We still have work to do on the measurement framework, and we have a lot of work to do on implementing this. So I think, Emily and I are just going to say a few words about what to expect in the year ahead, and some of the immediate next steps. So next slide, please. As Emily mentioned, one of the great learnings has been the country-led bottom-up approach for working from understanding, reviewing data towards a global progress report. And that will continue this year, and it will continue into the FP 2030 initiative. And so we anticipate now in 2021, the start up of our continual process of working with countries on their data. And I'll come back to Emily in a minute on the Track 20 plans for the year and plans ahead. Next slide, please. We still will be relying on a whole host of measurement partners in the FP 2030 initiative. The Performance Monitoring and Evidence Working Group will continue forward in the architecture of FP 2030, albeit with a new composition and aiming for a diverse group of experts that represent the countries that are committing to and a focus of the FP 2030 initiative. Several data partners, Kaiser Family Foundation, the Avenir Health, and the FP 2030, what has been FP 2020 Secretariat and will be a future FP 2030 data and performance management team, will be involved in all of this measurement work. And we hope that all of you will also be supporting the measurement work. I want to turn to Emily to say a quick word about Track 20's plans for this year and ahead, and what can we say about Track 20's future at this point, Emily?
Great, thanks. So for this year, the process of producing annual estimates will continue the same as it has over the past 8. And that process has actually already started. So countries are already reviewing their service statistics data and sort of taking those first steps to producing the core indicators from FP 2020, right? Since we don't have the finalized list yet for FP 2030, we're still working with the ones that we know, although we have expanded the analysis this year to include a lot of additional steps related to COVID. So there's a lot of additional analysis that's going on to look at any losses in 2020 and trying to quantify what that looks like in 2021, but also going forward, right? So reductions in adopters of long-acting methods and how does that look over time? So we're sort of continuing this year along the same framework that we have in the past, and we'll have annual estimates. Not sure yet what the reporting is going to look like, so Jason maybe can touch on that and where those estimates will go. But the important part from our perspective is that the countries will have them, right? So the countries will be able to continue to do their annual monitoring and to be able to assess their progress towards their own goals. So all that information will continue. Going forward, we're still in discussions on how Track 20 is going to align with the new FP 2030 setup, with the regional hubs and with the ability of countries outside of the 69 to make commitments. And so those are all very much still up for discussion on how we're going to sort of function within that new framework moving forward.
Thanks, Emily. And I think the slide shown here on data dependencies, I wanted to show because, as Emily mentioned, putting together estimates for countries relies on a huge number of data sources, and so this is not FP 2030 or Track 20 that are collecting the data in most cases. In most cases, we're relying on the work of many data partners. And unfortunately, this year is and last year were special ones, and there are not a lot of additional surveys that have been fielded and completed in this past year. So it is going to be an interesting year in terms of, or a challenging year in terms of progress reporting. And as Emily mentioned, it's a really critical year for relying on health management information systems to try to understand progress or change or backsliding, all of which are possible. So this is a very different year, but looking forward beyond these years and hoping to put this behind us, these data dependencies still will exist. I saw that someone asked about PMA. The PMA project is one of the data dependencies. It is one of the surveys that we rely upon, and they have just changed their name, I believe last year, from PMA 2020 to PMA, and continue to collect surveys albeit with some changes in many of the low-income countries, although not all, certainly not all the countries, and not an expanded set. Next slide, please. And as Emily mentioned, we are not totally sure what a progress report looks like this year, but we are committed to doing the progress reporting and working through that process with countries ultimately towards a first FP2030 progress report this year in 2021. So stay tuned on what that might look like. It may have quite a focus on COVID-19 impact and determining what we can say at this point, a year now into the pandemic, about the COVID impact on on family planning use and on women and girls and families' lives. So I think there's a lot of work to be done, and I wanted, before going to the Q&A, to ask one of my other co-leads of the Performance Monitoring and Evidence Working Group if they could say a word about the FP 2030 measurement agenda. So I'm going to turn it to Ilene Speizer before going to the questions and answers. Thanks, Ilene.
Thank you, Jason. I just wanted to point out, and I've been watching the conversation in the chat and then the questions and answers. The areas for future work that were proposed on an earlier slide that Jason went through, these are areas that came out of our discussions as we were looking into the measurement framework. And it came out of discussions with colleagues as well. And we really see this as a call to action. We don't see this as the PME working group is going to do this. We see this as the field is going to contribute to this. And we're really looking to everybody to engage in this conversation, to provide inputs around whether it's the indicators for social behavior change or measurement of policy financing, et cetera, equity, some of those things in that list. We're really we see it as a call to action. And as you advance those fields, it would be great to share it so that we can get those inputs into the measurement framework and into the continued discussions. And maybe even Emily can adjust the measurement approaches that they're doing if it comes from existing data sources. So I just wanted to say that really this isn't something that's just wrapped around FP 2030. It's really something for the field. So that's where I wanted to go with it. Thank you.
Thanks, Ilene, for that call to action, and I hope that you all will think about your role and your work and how you can contribute to advancing the measurement field. I know that many of you are already doing this, and we're just trying to point out critical areas that we think need attention. Okay, so with that, I'm going to turn over the moderation to my dear colleague Sesi. I know there have been a ton of questions here, Sesi, so hopefully you have a way of managing all these, and we'll do our best to answer these live as well as through chat, and we'll go from there. So to you, Sesi.
Thanks, Jason. Thanks, Emily. Thanks, Paulin, and thanks, Ilene, for your presentations and interventions. We have gotten a lot of questions, and I think we've done our best to respond through the Q&A portal and through the chat, but there are some that remain, and I'm going to try to just group them around different themes that came through, so hopefully you can address a few of them at the same time. So I'll start with questions around demand. So we had someone note that when they saw the framework graphic, there were no indicators under the demand and empowerment interventions section of that. A couple of people noted that actually. So if you could touch on sort of how demand is addressed in the framework. And then someone also asked about whether we'd be looking for commitments from countries on increasing demand, or if the commitments would only be focused on sort of the supply side. And I think a related question is, someone asked, how can we better capture choice and non-use as a measure of success and women being able to exercise, their contraceptive choices. So if you could kind of address those three pieces on demand within the framework, demand and commitments, and sort of measuring demand and choice and non-use more broadly.
Just a simple question. Emily, do you want to say just quickly a word about how you were talking about demand in the slides that you presented on the demand curve and the supply versus demand, just so that that's clear?
Sure. So the analysis that was shown was looking at ideal number of children as the sort of proxy measure of demand, right? So the actual translation of that would be the demand for smaller families. So the same analysis has been run using unmet need, using intention to use, so using various indicators that would sort of look at demand from different perspectives. And all of them in general tell the same story, although the fit with the line is the cleanest when we look at ideal family size. So it would be interpreted as sort of demand for smaller families.
Thanks. And we have not reviewed that as a possible indicator, right? I mean, that has not been, when we're talking about possible indicators for FP 2030, it's, you know, we've not really ever considered that as a possible indicator. It's a good starting point for understanding data in a country, right? But not as an indicator.
Yeah, I mean, when we first started looking at that analysis, it was mainly from a perspective of how ambitious can you really expect to be in terms of growth with MCPR, right? So at the very beginning of FP 2020, when countries were setting their first goals, we had a lot of countries who wanted to sort of show their level of commitment by setting very, very ambitious targets that in many cases were sort of unreachable, right? So the intent of this analysis at first was really to try to ground some of those discussions in reality, right? To say that, ambition is different for different countries, what you can achieve in the next 5 years is different for different countries, and trying to look at it from different perspectives of what might be a realistic, or what are some of the factors from your country that are that should be thought about or discussed when thinking about setting that goal. So that was sort of the original intent of it. And then we played around with it a bit, and we're able to sort of then use it as this idea around, if you're over investing in access, but you really don't have very many people who want to use family planning. Now, this from a definition of, you really want women who want to be pregnant, then we need to think about either setting a much lower goal, which is completely fine because it would still be hard to achieve, or those investments should be shifted towards demand generation with an expectation that short-term gains would be less. So it's not really meant to stand on its own as an indicator, or to be included, as a single line. It's more useful, we think, from, as part of an overall discussion for different activities in country, right? So it started as goal setting, and now it sort of goes into goal setting, but also sort of prioritization within CIP development. And if you have all access, if all of your priority interventions are related to access, then let's take a look at this and see if that sort of fits with where you sit right now, and should we have a better balance. So yeah, I completely agree. It's not really meant to be a standalone indicator.
Thanks. So on the point of, whether commitments are intended to focus on the just supply side or supply and demand side, certainly hoping that, understanding of, with an understanding of data, that countries are looking at both supply side and possible demand generation activities. So those are certainly part of the conversation, but that's where we know where we don't have a clear set of indicators, and we hope that that partners who are working in this space will help to work with countries and work on the global community towards indicators. There's also a healthy conversation going on in the PME working group around the language of the indicators of what we call unmet need and demand satisfied right now. And you can expect in the near term, we hope a commentary from the PME working group on that language and the use of unmet need and demand satisfied in the context of these ideas of need for contraception or demand for contraception. Ilene, did you want to say anything about the unmet need commentary that you and the PME working group have been working on?
Just that we've been thinking about these issues and the challenges with the language and the measurement of it, and are putting something together that we hope will come out in the next few months. Don't want to overcommit.
Thanks, Ilene. Okay, Sesi, lots of questions going there. So you just tell me what to answer and we'll do our best.
Great, great. So I think the next sort of area where there have been a lot of questions is around inclusion of couples and men. So we had Anfitzer who remarked that the vision result statement is sort of gender agnostic, but otherwise the FP2030 vision speaks to enabling women and girls to make choices. And we had a couple of other people also note and ask about, whether men and boys were included in sort of the thinking for developing the framework. So I wonder if you could just talk a bit about, what those discussions were like with the PME working group and how we arrived at the statements and framework that we have.
Thanks, Sesi. Sorry, I was just making sure I was unmuted before I was talking there. So the vision that I showed earlier does squarely focus on women and girls, but lost in just looking at that vision are the guiding principles, and I'm just drawing them up right now on my screen, and they are available in the building Building 2030 link that my colleagues shared earlier and that I hope they can share again now. So the vision for FP 2030 has a set of guiding principles, and among them are our principles around empowering women and girls and engaging men, boys, and communities. So the second guiding principle is positive male inclusion is needed to truly transform normalization of family planning and at the same time share the burden of the decisions and implications of family planning. This must happen in tandem with empowerment of women and girls to create true equity. So it's certainly there in the guiding principles of FP 2030, if not stated directly in the vision. We have not talked about particular indicators or equity, an equity index that looks at specifically measuring among men and boys. So that, but certainly when we looked at the vision results statement, the PME working group thought it was important to say by everyone who wants it. So that does support the idea of men and boys being included. Certainly in our contraceptive use measures, we're capturing use. We ask women about their use or use by a partner. So we are capturing male use of permanent methods, vasectomy, as well as couple use of condom. So those are short but probably incomplete answer to that. And I urge the community to continue to push on this front of measuring among boys and men. All right, Sesi.
Thanks, Jason. So I think the next group of questions are sort of around, if we can go back to the measurement framework slide, I think this is around the sort of the left side of that framework, which covers the enabling environment for family planning in terms of policies, financing, and accountability. And so someone wanted us to clarify sort of what we're measuring or what we can say about that side of the framework as one question. I think another specific question we got is, how we measure or estimate family planning expenditures. And then I think a third related question is how this work on measurement on the framework ties to the country commitment process and tracking progress on country commitments.
Okay. Emily, do you want to say a word about the NCIFP, or the National Composite Index on Family Planning, and its possible future?
Yeah, I guess maybe just quickly, since it's still in process, but we're actually in the process of relooking at the NCIFP and the questionnaire, and trying to determine if there's any adjustments that need to be made going forward to make sure that we capture any component of sort of rights and empowerment that we can through a key informant interview. I guess I should have said, for those of you who don't know, the NCIP is the National Composite Index for Family Planning. It's a key informant interview that is built off the Family Planning Effort Index, which has been going on since the 70s. But the idea with the NCIFP was to add some additional questions on rights and empowerment. We've had 2 rounds of the NCIFP, and so we now have the opportunity to take a look back at that data and to determine, with the group, if we're happy with the questions that were added, or if there's even more that we can sort of push ourselves forward to make sure that we're not losing an opportunity to collect information, in domains that really have very little available information already. So maybe I'll just stop with that, but we're hoping that the next round can be done this year with the modified questionnaire.
And so, the idea is that the NCIFP, which is built upon as Emily mentioned, the FPE, provides insights on aspects of rights and empowerment, but also around accountability and policy that will help us to get at the supportive environment level, or some of those aspects of the supportive environment level that we're not capturing through household surveys, through service statistics, and that this could become a regular part of reporting, not annual. But a good example of this is if you were to look at UNAIDS. UNAIDS has every so often, I believe it's every 2 to 3 years, produces a policy report that relies on a policy instrument, in some ways related to the NCIFP, and they're able to do country by country reporting on that as supportive environment. So that's one of the ideas, as Emily mentioned, and it's still in the works on how that might be modified. On the expenditures, the decision among expenditures partners was that we're really still in the early days of annually tracking family planning expenditures, both at the domestic level, at the donor level, and at the out-of-pocket level, and that we should not change our process at this point. And there are several data partners that are working on collecting domestic expenditures on family planning with countries, and that we still need to learn from that effort before changing anything. So we are proceeding with the approach we've had, and happy to detail that, or you can find more information through the existing FP 2020 progress report, and the reporting on those, which will not change under the early years of FP 2030.
Thanks, Jason. And I don't know if you could just touch a bit on the last question about how the measurement framework development process and the framework itself ties into country commitments and tracking progress on country commitments.
Emily, I mean, do you want to say a word about how the process of developing commitments and how the country work on setting goals ties to M&E officers? And I guess I can talk a little bit more about the broad commitment process.
Sure. So I could just say that, one of the things I didn't talk about in the presentation was how much we have learned about goal setting over the last 8 years, and the importance of finding a way to support setting ambitious but achievable goals, and the way that that links to accountability. And so with FP 2020, well, actually, Sesi and I initially did a first round in West Africa at the last focal point meeting, a discussion, with different focal points from the region around sort of different ways of approaching goal setting, sort of the advantages and disadvantages to each one, how that should link into your CIPs, to making commitments, to other country strategies, to make sure that the approach was consistent across. And I think that we got positive feedback from that, and we ended up doing a round of goal setting workshops with each of the different regions for the focal points, to sort of talk about that, to get them ready, not only for their new rounds of CIPs that are happening in many countries, but also for commitment making, to make sure that we had a much more supportive process on how to set goals than what was there in the beginning, right? When the entire infrastructure of FP 2020 and all of its partners weren't there, right, when those commitments were being made. And so we have developed an approach, quite a flexible approach, that sort of outlines the different ways you can set goals and why countries may choose one over the other, to try to have a more stewarded process this time. And one of the ways that we're trying to support that through countries is tying in these trained M&E officers who know these approaches and who know the different ways to go about goal setting, and making sure that they're seen as a resource in countries for the process this time, so that we're having sort of these discussions and asking these really important questions about the goals that they're setting as they're being set before they're finalized.
Thanks, Emily. And I hope that one of my colleagues can share as well the commitments website that has been created by FP 2030. It's Commitment Guidance Toolkit, which is available for countries to review and to use for making commitments. I will say that the guidance, the lessons we've learned, and the technical assistance for making commitments is completely different than in 2012, when when commitments were made at the London Summit on Family Planning. And furthermore, I really think that the work that we're doing on stewarding commitments, and I like that wording, Emily, is novel here. There is not a global moment at which we expect leaders to come forward and make commitments. That's not the approach that is being taken. I think the approach that's being taken is one of a thoughtful review of the context of the country, the data that are available, and that review happen not just within the government, but at a large country and stakeholder level. That commitments are developed in country, shared in country, launched in country, and then expressed to the global community. And that is very different than going to a summit and having a leader make a commitment that nobody in country has ever heard about, that may rely on some data analysis that was whipped up and that wasn't shared widely. So this is a very different process. And lastly, a lot of people have asked about accountability structures and accountability frameworks. Also in the commitment guidance are tools and guidance around accountability, and we're asking that countries establish an accountability framework or an accountability approach at the outset and include that in their commitment. And that accountability approach can include annual data review, as Emily has mentioned. It can include citizen-led accountability through CSOs and others working on a review of progress and tools such as the motion tracker, which has been tried in several FP2020 countries, or has been implemented in several FP2020 countries. So this is very different than the past, and I hope that you'll all explore that. And I think the FP2030 measurement framework is just one piece of that accountability framework and that commitment making process.
Thanks, Jason and Emily. One other, or a couple of other questions we got were around quality and sort of our plans to measure it in the new framework. So I don't know if you could talk a little bit about that, and maybe if Ilene has some thoughts as well from the PME perspective, just on, looking at other dimensions of quality, such as client experience and client satisfaction.
Thanks. So I think that this has been an area that's been obviously been prominent in family planning measurement for quite a long time, and I won't pretend to say that there aren't measures of and efforts that organizations are already using to monitor quality, both from a facility perspective and a client perspective. Those, however, are not aligned across an entire public and private system, certainly not aligned across countries, and often rely on a very data-intensive set of tools that can capture all of these measures of quality. So amongst the measurement agenda areas is improving the monitoring of quality and identifying, I think, a streamlined set of measures at a facility level and a client perspective that could be measured across countries and across and over time. So this is one of the measurement agenda areas. I think it's one of the areas that's further along. So there is quite a bit of work that's been done, and it continues. But we have not arrived at a clear space where we have aligned measures that can be put in a framework here and captured consistently across countries and over time. So that's I think all I'll add on that. Turn to Ilene or Emily if they want to add anything further.
I would just say that this is another place where the call to action is really there. We know that, as Jason said, many organizations are working on this, but really try to be working on it with the frame of what could be used at a global level, can be used across programs, and what could go into these sort of standardized surveys in a smaller set of questions to capture the client perspective, as well as potentially broader than the client perspectives on quality from a potentially community perspective as well.
Great, thanks Jason, thanks Ilene. I see one that came in, I know we're running up on time, so maybe this might be the last question, but this came in through the Q&A for Emily. The question is, are the trained M&E officers considered as a resource only to the government for goal setting and making commitments, or also to non-government partners working in the countries?
Absolutely, they're a resource to non-government partners working in countries, and I hope that you'll all access them. So absolutely, they they've spent the last many years having the luxury of dealing with family planning data pretty much full time, right? Which is something that really didn't exist before FP 2020. And so they have a lot of information and the knowledge that they've really gained over the many years. And I hope it's a benefit to all of us. So absolutely.
Excellent, thanks Emily. I think that is probably a good note for us to end on in terms of the Q&A. So I might turn it back to Jason to wrap things up.
Well, thanks, Sesi. Thanks, Emily. Thanks, Ilene and Paulin, for your participation today. This is our broadest webinar yet in terms of sharing what we've learned, what's coming next. and how you all can participate and contribute. It's been a fantastic ride over the last 8 years of 2012 to 2020, but we're certainly not done, and we have a lot to do, especially with the challenges that COVID has created, not just for services, but for measurement. And so I appreciate all of your time and work, both in the past and in the future, on the FP 2030 measurement framework and agenda. I want to just close by saying a special thanks to our dear colleague Sesi. Sesi is the longest standing member of FP 2020. He's been with FP 2020 since he started as an intern. He's been with us for 7 years, grew from intern to officer to associate to manager, and has been an incredible part of the FP 2020 partnership and the heart of a measurement. Sesi is leaving us now in 2021 to new adventures, and I hope that you all will wish him well and see him off. So thank you, everyone, and a special thanks to you, Sesi, for your contribution. I hope you all have a great day, morning, afternoon, or evening, and we'll do our best to post this quickly, post this recording quickly, and try to answer any additional questions that you might have, potentially through an FAQ on the measurement the measurement agenda and framework. So thanks all.